So as someone who's written a very thoroughly researched book, how did you encounter any such challenges or dilemmas when faced with such multiple sources of facts? And I ask that because the scientific community in general has really struggled with communication with the general public. So would you have any recommendations for that?
Yeah, it definitely changes over. I mean, science works in a way where we have new information and our ideas change over time. The public necessarily does not see it that way. They see it as like, okay, you were wrong early on. Like, okay, you told us that masks don't work. Well, we didn't have information on that. Or somebody said, for whatever reason, there was a miscommunication with masks, definitely, in parts of the world. There was a miscommunication with a number of drugs early on that people thought worked, which didn't work as well as expected. On the positive front, I think people were very worried about surfaces and objects early on last year. People were even like washing vegetables, leaving them outside. Now we know that that's not a major way that how this. So there are aspects of this that are positive as well. But I think what we have to look at is like, who is the source of this information, where it was published, how well established it is, and whether it fits with common sense. I mean, so I can recall one piece of this that basically missed all of these, and it appeared in a prestigious newspaper like The Guardian last year. And this was this indication that that smokers had and this came out in WhatsApp and everywhere else as well. And it was actually in The Guardian, and it got like a number of hits. So if the journalists had dug a little deeper, then what would have been found is that this was the basis of not any type of scientific, rigorously done, statistically powered study, but a questionnaire. And then the questionnaire at one single hospital in France, this questionnaire was written up as a perspective viewpoint. It was not even a peer-reviewed paper that was put on a social sciences preprint server by a scientist who is a neuroscientist. So at multiple levels, this could have been checked and vetted by someone. And this was outside the expertise area of the person. This was a retired neuroscientist. But this was not vetted at that point. So I think, and it didn't fit even the smell test of common sense of why something might happen. But this was taken up, and this is one example of this. I think another thing that we've often tried to do is to inform people that to stick away from binaries of does this work or doesn't it work? And I think we want to give the bigger message and the broader picture, but we also want to tell them that there are no absolutes. There isn't really no black and white. And I think the one thing where this came up is with with immunity in reinfections. At one point, I think you'll recall, the discussion was, okay, we know that immunity post-infection in most people who are symptomatic lasts for at least 6 months. Now, this was sort of fashioned and became in the news media, and broadly speaking, immunity only lasts for 6 months. No, of course not. We only had data for 6 months. And so this is another place where it was not sort of this black and white, but it became like this black and white situation. So I think definitely we have to keep these types of things in mind.